All right, thank you all for joining us today. My name is Christopher Jammer. This is your first time joining us, and I'm with Airrosti Rehab Centers. And today we have with us Dr. Westbrook, and we have a special guest, Dr. Dakota Robbie, here with us from Airrosti as well. So, for those of you who are unfamiliar with Airrosti, we are a healthcare provider group. We specialize in treating soft tissue injuries. So, that's anything from your head to your toes, as long as it's not a fracture or a break within the bone or a full thickness tear that's gonna require surgery is gonna be something within our wheelhouse. So just to go through some housekeeping items before we actually go into the content, as you guys all noticed, whenever you were admitted into the presentation, your microphones were muted. That's so we can cut down on some of the background noise and Dr. Westbrook can get all the content to you as quickly and as efficiently as possible. But if you guys have some general questions that you would like to ask about any of the content of the presentation, you're more than welcome to utilize the chat function to send those over to us as well. If you guys have any specific questions that you would like to ask about an injury that you might be dealing with or some more so kind of specific questions, you can utilize our virtual injury and pain chat. And throughout the presentation, you'll have a QR code kind of at the top right-hand corner of each of the slides. So without further ado, I'm going to turn it over to Dr. Westbrook to talk to you about TechNeck.
Awesome. All right. So tech neck is something that is just a 21st century problem that all of us deal with. It's that kind of area, and you even just like the previous slide had the guy kind of grabbing here. This is the spot where a lot of my patients come in going, it's this, it gets worse at the end of the day, or maybe I wake up and I can't really turn my head to the left. But it can really even range from anywhere kind of through the mid back, in between your shoulder blade and spine. It can also lead to some like nerve problems in your hands that we'll talk about. And then we'll get into some ways that we can prevent, or if you're already experiencing some of these symptoms, we'll be able to kind of give you some tips and tricks to kind of head off, get a handle on your pain and get you feeling better here. So let's dive on in.
So before we get to the actual content as well, Dr. Westbrook, my apologies. For all of you who are on the presentation, when in the chat function, could you send me your first name, last name, and your employee ID number so we can make sure that you get your wellness credits as well?
Get those points, and learn about TechNeck too. Alrighty, so TechNeck defined. This really is not an actual like diagnosis. Most of the actual diagnoses are going to fall under the sprain strain, which is kind of boring. Usually it's soft tissue though. But again, it kind of just, any kind of discomfort sort of from the base of your skull down even to kind of like this mid back area would be kind of falling under the tech neck umbrella. You can also, if you want to Google something, I'm not against Dr. Google. You can also look up upper cross syndrome, and that will also kind of show you some of these same kind of conditions here. But a lot of people were starting to see more of this because of the looking down and the scrolling and the TikTok and the Instagram. And I happen to play a lot of spider solitaire on my phone, so I'm also a victim of this as well. But computer work, bad posture in general, if you have a really squishy sofa that you kind of sink down into, these can all cause some tech neck-like symptoms. You can start developing headaches and numbness, tingling in your fingers. And so we'll start jumping into the first real condition here. Awesome. Okay, so upper cross syndrome. Again, so you can see it on the picture. We have this cross here because it's actually caused by weakness and tightness that like kind of come in that crossed position. And so first the weakness, and these are things that like, even if you go to the gym, even if you work out at Orange Theory 5 days a week, you're still gonna have these weaknesses because they're these small stabilization muscles that are really key in keeping our posture nice and pretty. The first one sits in the front part of your neck. If I were to like move your trachea and your esophagus out of the way, you have these thin strappy muscles that sit in the front part of your spine called your deep cervical neck flexors. Those help hold your head over your shoulder. So in this position, when my chin's jutted forward, they are not active, they're not helping at all. And so the things that are helping to hold your head on your shoulders are all these muscles to the back portion of your neck. So if this guy is weak, then suddenly all of the muscles here have to tighten up to do the work of 2 players. The other thing that tends to get tight, again, on just kind of everybody here, is our pec muscles. So everything that's pulling our shoulder forward, we drive, we type, we lift our kids up in this position. And so our pecs automatically start to roll forward and get really, really tight. Again, it's pulling pressure, pulling these muscles here, making them tighter. And that happens because these mid-back muscles here, our rhomboids, our lower trap, they're just weak. We just don't use them enough. We're stretched out when we're reaching forward. And so we end up in kind of just the old lady position here that really starts to put a lot of stress and strain on not only your muscles, but also your joints as well. All right, we'll go to the next slide here. So tension headaches. Okay, so upper cross, like I said, upper cross and tech neck cause all of the following conditions. Tension headache would actually be a real diagnosis. And usually the symptoms of a tension headache is you're going to be kind of like rubbing your forehead like this. Some patients will describe it as if they're like wearing a hat that's too tight. It might even kind of cause some pain like right behind one of your eyes. Sometimes they're on one side of the head and it might kind of swoop up in this area here. And again, it's because suddenly everything is being pulled forward here. All these muscles are tightening up. They're starting to irritate the nerves. And so these are a frequent cause of headaches. And usually these will start to get worse at the end of your day. Other headaches sometimes can kind of get confusing, and they might be caused by like red dye is a really common trigger for migraine headaches. If you have any kind of gluten sensitivities, that time of the month, hormone fluctuations, stress, they can all also cause your tension headaches to get worse or even cause different types of headaches as well. And the key player in some of these actual headaches is called your suboccipital muscles. Those are the ones that sit kind of right at the base of the skull. And so sometimes patients too will have a headache, but it really only stays back here. And you have nerves that run through these muscles here, and it will cause an occipital neuralgia, which is that same type of like hat band headache or headaches that kind of come along the skull like this. Also, another thing to think about is blue light glasses. Blocking blue light glasses can also sometimes help get rid of some of these headaches or the frequency of them. All right, we'll go to the next slide. Mid-back pain. Okay, so that is when those stability muscles that we were talking about in the upper cross syndrome, your rhomboids and your lower trap, which are highlighted in the orange color here, they are trying their very best to hold you into this nice, pretty posture, but they are just failing, unfortunately. They tend to be weak. And so this is that really like nagging pain. A lot of people you'll like notice, like maybe in the next month, you're going to see one of your coworkers kind of like squirming around while they're mousing or using the computer or anything like that. And that's usually because those rhomboids and that lower trap, they're trying to pull those shoulder blades together to keep you in nice, pretty posture. But again, everything here is just so dominant that those rhomboids are kind of losing this tug of war. Sometimes pain through there is actually a referral pattern from your neck. That's not typically what I see in my office, although every once in a while we will have somebody who has either joint irritation or even a little bit of a disc issue in their neck, and it will refer pain down into that mid-back. But that's usually more like, oh, you move your neck and you're like, ooh, yeah, that actually hurts lower down than my actual neck is. And so that one's not as common. We usually just see this kind of like overuse fatigue, which really feels more like a strain or a sprain kind of feeling. And so strengthening those rhomboid muscles up, strengthening your lower trap, and some of these other little stabilizers can really help give you some relief in that area as well. All right, we'll go to the next one. Thoracic outlet syndrome. Okay, so this is one of my we all end up having these weird conditions that we love to treat, and I love thoracic outlet syndrome because it actually responds so quick to what we do. And in this anatomy diagram, you're seeing both of your pec muscles. So that big guy is called your pec major. It's the one that we really like see after we do a bunch of bench presses and overhead bench presses and all those sort of things. Your pec minor, that's the little guy over there. And he's really the root cause of a lot of our issues here. And you might even be able to see how that pec minor is actually attached to your shoulder blade through your arm. And so it's attaching to your back, but through your armpit essentially. And underneath that pec minor, we have a bundle of nerves that are coming out from your neck and blood vessels that are coming up from your heart that are passing right underneath that pec minor. That pec minor, it's responsible for rotating our arm in like this. And again, it's just being really active and crunched up all day long. And so my thoracic outlet syndrome patients, they'll be like, oh, my hand is numb. A lot of times at night, it will get really bad if you sleep on one side and you wake up and you're like, oh, my hand. Sometimes even your whole arm will go numb, like sometimes elbow down, those sort of things. But it's it's usually all of your fingers or like these 3 or these 4, but it's not a really distinct pattern when it comes to the numbness and tingling. And usually you might have a little bit of grip strength weakness, but it doesn't usually cause a whole lot of actual weakness in your hand. And it will go away pretty quickly with some movement and some stretching, but it can be very uncomfortable. In a lot of patients that have this, they can only do like computer work for like 30-minute increments, and then they have to go and shake it out and kind of wander around to let the hand kind of come back to life. And some patients are also more predisposed to this based on your anatomy. Some people have like a little extra rib that can cause the thoracic outlet syndrome to kind of come on a lot more quickly. But anytime you have a lot of tightness here, you are compressing on some blood vessels and arteries and nerves. And it sounds scarier than it is, but this is a really pretty easy one to treat. Like 2 treatments and some stretching, and you're on your way, happy as a clam. All right, so now we'll go to the next one, because this is also a very related injury, carpal tunnel. This one is also misdiagnosed quite a bit. I'll have patients that come in, they say, I have carpal tunnel. The real key fingers for carpal tunnel are the 3, your thumb, your index, and then your middle finger. Those are all fed by what we call your median nerve, and it passes through your carpal tunnel here in your wrist. And so a lot of typing, if you hold one, this tends to develop more on your dominant side because you tend to hold your phone. And we're starting to tighten all these muscles in our wrist and forearm up that tend to compress this. It can, again, also be from up the chain. If your shoulders are weak, then suddenly everything's kind of just being crunched and caved in and can cause carpal tunnel to pop up. Some of my patients, the numbness tingling actually starts down here in their forearm, which that's not carpal tunnel, that's actually pronator Terry syndrome, but it's the same nerve, same cause, getting compressed higher up almost to your elbow, typing, opening jars, and these are also things that tend to get worse at night as well. But it's all coming from your median nerve, which tends it feeds these 3 fingers and like half of your ring finger here. But that can be very debilitating. Again, having to take frequent computer breaks to shake that hand out. Also, if you're pregnant, this is another one that'll come get you when you're pregnant in the kind of like later stages of that 3rd trimester. All right, we'll go to that next slide. All right, prevention. This is really what we're here for, is preventing upper cross syndrome. All these exercises will also help to alleviate any symptoms that you're already feeling, because pretty much if you are over the age of 35, you have had or will have pain kind of right in here. That's just one of those like human things that we all deal with. But how we do prevention or even treating through existing symptoms is strengthening, stretching, and foam rolling or mobility. And those are kind of the recipes that we give you in our office, is myofascial release, stretching, and strengthening. Those are the keys to any kind of therapeutic exercise routine. All right, so we'll go in and we're going to teach you guys a couple good exercises to be doing. So I am a firm believer that every household should own at least a few lacrosse balls, which they're just like hard, dense, cheap balls that we use to play the sport lacrosse. Not many people know about it here in Texas, but it's just a really like, you can't really squeeze it. It's not like a squishy stress ball. It's harder than a tennis ball, but it's about the same size. I think every household should have 2 or 3 of these, and I think every household should have at least 1 foam roller as well. And so the thoracic extension or the thoracic foam rolling is going to help release all the tissue that sits in between those shoulder blade and spine. And the other thing that you can do with it is really trying to arch back and restore some what we call thoracic extension. And if your thoracic spine isn't moving properly, then it's going to start leading to more tension in your neck and even your low back as well. But the foam rolling, it is a hurt so good kind of process. And so you do have to sort of put up with some of your own sort of pain, and you're doing it to your self-inflicted pain. But it does, it hurts so good. It's very like relieving kind of pressure. And you might even get some of those really satisfying snap, crackle, pops in that mid back. It's always kind of funny to see people go, oh, look how crunchy I am. And that is all the foam rollers just kind of helping to release those tissues and get some of those Rice Krispies out of our bones here. All right, we'll go to the next slide. Oh, seated neck stretch. And so this is something that, like, if you guys are, even if you're not seated, you can do this standing, but we can all do this right now. And there's a few different directions that we can target to really get this spot, if that's like, it's like probably the more common area where the upper cross manifests. And you can see she's grabbing on the edge of her chair. The purpose of that, I'm going to roll back so you guys can see me a little better. Laptop problems here. Okay, yeah, better. Okay, so I'm gonna grab the edge of my chair with my right arm. And what I'm doing is I'm trying to pull my arm down. Without doing that, if I were to stretch my neck, I would really have to pull and crank my neck over, which can be kind of uncomfortable. And so if you grab the edge of your chair, you can also sit on your hand. That's gonna pull down, traction down on your arm. And then you're gonna get a deeper stretch without having to really wrench your neck over. A good rule is to hold this for at least 30 seconds. And what I like to do is actually find 2 different positions. So you can do this 2 to 3 positions. And with each position change, you're going to kind of feel how that stretch changes. So you can kind of look up over your shoulder. It's going to stretch more through the front of your neck. Hold that for another 30 seconds. But then my all-time favorite is the armpit sniff. So kind of pointing your nose down towards your opposite armpit, and it's going to give you a really good stretch more in the back of your neck. The tip that I give people who are having trouble finding the stretch, some people are like, I still can't find it, is instead of just grabbing your chair directly from the side, reach backwards and grab the back edge of your chair, pull that shoulder back, and it's also going to give you a better stretch without having to really wrench that neck over. So we can also switch sides. You might find that one side is a lot tighter than the other. I'm very, very right-handed, so my right side's tighter than my left. And in that case, you can also start on your right, then go to your left, and then finish on your right again to give that right side a little extra love. But spend 20 to 30 seconds in each position. Like I said, I really like my armpit sniff direction. It's called your levator scapula, if you want the technical term here. And then this one, I don't feel as much stretch. This one probably isn't worth it when I really kind of look up and over. But as long as you aren't in pain, you might get a little bit of numbness tingling in your fingers with this. And I'm okay with a tiny bit of numbness tingling in your fingers with this stretch. That's pretty normal. But if it feels like there's like 1,000 ants in your hand, or if your hand's on fire, then discontinue. And that's definitely something that you can chat with either one of our VIP chats or come into the office and get an assessment done in office, because that might need a little bit more soft tissue work before that muscle is ready to stretch. All right, we'll go to the next slide. The wall stretch. Okay, so we also call this the anterior pathway stretch, and I really like this one because it's kind of a good catch-all. If you have that carpal tunnel, if you have the thoracic outlet syndrome, what you're going to do, especially because you might get a lot of numbness tingling in your hand here, but you're going to find a wall, you're going to point your fingers away from yourself, and you're going to twist your body away from your wall until you feel a good stretch. And where I personally feel this stretch is a lot in my hands, because I'm using my hands all day long treating my patients, a little bit in my forearm, and I feel a ton of stretch right here in through my pec. Some of my patients feel it mostly in their biceps. Some people feel it mostly here. But the great thing about this wall stretch is it's going to stretch what needs to get stretched first. And so maybe that's your forearm, maybe that's your pec minor, but it's going to target what the tightest tissue is. And again, holding this for at least 30 seconds. This one's a good one to do for even longer. And if this is causing a lot of numbness tingling and you really can't hold it long enough, what you'll do is, instead of keeping your arm straight, you'll just grip the wall with your forearm, and same thing, you're just going to twist away and get a nice stretch through the pec here. So if this is a little too intense for you, you're just going to make it a little easier, take that bicep out of the equation, but you're still going to get a really good stretch here. Another good one is if you have a door frame, you can wall angel, like kind of pretend you're an angel and just lean forward in that door frame and get both at the same time, which I love a good bang for your buck here time-wise. All right, we'll go to the next one. Okay, so protraction retraction. So this is going to strengthen those deep cervical neck flexors that I talked about earlier on in the presentation. And sometimes this exercise is more of a like trust the process kind of exercise. Some of my patients don't feel very much while they do it, and that's okay. A great place to do this is at a stop sign. Every time you're waiting at a red light, do like 10 chin tucks here, but I'm gonna turn to the side. Keep your head neutral. I don't want you looking down. I do not want you looking up. I want you to just keep your head nice, neutral, nice, pretty posture. And then all you're gonna do is like turtle in the shell, or my other verbal cue that I like to use is stinky sock. You smell the sock? Ugh. Smell the sock. Ugh. Ugh. And so you can also give yourself a nice little double chin that makes everybody look so pretty. But what this is doing is strengthening those deep cervical neck flexors. And at the same time, it's kind of shutting off all these neck muscles in the back as well. And again, if you feel like you're overusing these, that's another good sign that you probably need some soft tissue work to kind of loosen things up before we can really get these deep cervical neck flexors activated. I also don't want you doing this if every time you do it, you feel a pinch the back of your neck. That's usually a joint capsule issue. And again, a good deep tissue work can really kind of help relieve some of that so that these are more effective. But this is a good one to do. Like the stretching, do that twice a day. Once a day at the end of your workday, baby. This is a good one to do every hour that you're at your computer. Just wrap out 10. If you are a teacher in the classroom, in between classes, rep 10 out. You don't have to hold it for very long, maybe just 1 or 2 snaps and release. 10 chin tucks about every hour. And what that's going to do is neurologically, like we're also playing with your brain here, neurologically, it's going to keep these muscles active and these muscles deactive, and it's going to naturally give you better posture over a period of time. All right, and that'll take us to probably scapular retractions is my guess. Oh, wall angels. Ooh, but this requires scapular retractions. So this one's funny. I love giving this one, and it's actually really hard if you are really strong, because this requires not only stability muscles that we're going to be using that just, again, don't get used very often, but this one also requires good shoulder mobility, which a lot of us don't have. So let me find a good wall, because this is a multi-step process exercise here. Yeah, we'll be able to do this. Okay, so I'm going to come over to my door. Any blank wall will do, but what you're going to do is come, and this is a multi-step process, so take notes here. All right, so you are going to get your butt up against the wall and your back up against the wall. I like to take like maybe one half step away from the wall, because it just makes this next step a little easier, but that arch in your back. So right now my middle back and my butt are on the wall. I'm going to take the arch out of my low back. So I'm going to roll my hips up. I'm going to flatten my low back to the wall. That is step 1. Step 2 is you are now going to do a chin tuck. I really probably shouldn't have a ponytail in right now. If I could get the back of my head flush against the wall, that would be ideal. But we're not going to unleash that beast today. So push the back of your head into the wall. You're basically doing a chin tuck or cervical retraction that we just discussed into the wall. Elbows on the wall. And this is the tricky part, fingertips on the wall. Some people, your wrists might come out. Just try your best to get your wrists and your whole arm flat on the wall. And then you're going to do 10 snow angels up there against the wall, hence the name wall angel. But this is such a great exercise because it is using all these different small stability muscles. So I'm using my deep core to help flatten my low back. All of us need core exercises. That's just, again, a universal truth for all of us. You're using your deep core to flatten your back against the wall. You're using your cervical core, which is those deep cervical neck flexors. You're also using your rhomboids, your lower trap to do the actual movements and to keep your arms and shoulder against the wall. And so this exercise takes a lot of thought. it's almost harder to think about all of these things and trying to use these muscles together as a team. Because right now, you could probably use your rhomboids, no problem. But can you use your rhomboids at the same time that you're using your lower trap, at the same time that you're using your deep cervical neck flexors, at the same time that you're using your core? And so this is an exercise, like at first, it kind of looks a little easy, maybe even a little goofy, but without fail, everybody's like, oh my God. And like I get a cramp in between my right shoulder blade and my spine after doing about 3 of them. For me, my goal would be to like do 10 without any problems, maybe a little fatigue at the end, but that's surprisingly hard. And on the model here in the picture, if you have trouble getting your wrists anywhere near the wall or your fingers, you can kind of cheat and rotate so that your thumbs are out towards your face and your pinkies to the wall. And then eventually, as your range of motion improves, you'll be able to get those shoulders back a little further, get better contact on the wall. This is an exercise that if all my patients did at the end of their workday, when they were putting their laptop up, just to kind of hit that reset button, get everything stabilized and moving again, a lot of people would stay out of my office. This is a really good kind of catch-all exercise. Alrighty, we'll go to the next one. Oh, okay. And I will pass it back to Chris Jammer. Or are there any questions?
I think we have one. It says palms toward the wall or back of the hand toward the wall?
Back of the hand towards the wall. Yeah. Mm-hmm. Yeah, no, definitely back of the hands. You wouldn't want to do palms towards the wall. Mm-hmm. But like, and like, you can even look when you do your wall angel. For me, my right shoulder is my tight, overused one. And so I have to like arch my wrist to get my fingers on the wall on my right side, whereas my left, I can keep it like relatively flat. And so there's also little cues that you can kind of like work towards like, oh, like I hope someday my right can do it the way my left can. And just seeing how unbalanced our bodies become over time from overuse.
Perfect, Nancy, Dr. Westbrook. So just to give you guys a little bit more of an overview, most of you have heard this before, but some of you, if you haven't, just what Dr. Westbrook talked about today, just kind of how we dive a little bit deeper into the different injuries or the different symptoms that a lot of you guys come in with, or patients come in with in general. That is the reason why we have the statistics that we have on the screen right now. So more so, we're looking at to figure out where the source of the pain is coming from, why the source of that pain is coming from there, open up those types of things for you and get you better a lot more efficiently and a lot faster. So on average, we see patients about 3 to 4 times to get you out of pain, and to get you back to doing the things that you love to do. And because of that, 99% of most of our patients will recommend us to their family and friends. And for those who might seek other care in other places, either have gotten an x-ray or an MRI, maybe come from a specialist or even receive prior physical therapy or chiropractic care, we see all those different patients. So like we say, we like to make sure that we're not in a hamster wheel of healthcare. We're also figuring out what we can do for you guys as you come into our offices. So, and today, Dr. Westbrook talks specifically about different conditions that are associated with the excessive use of technology. But we see a lot of different things coming to our offices where it could be something chronic in nature that you've been dealing with for months and years and decades on end, or it could be something acute like an ankle sprain or something that you might have just walked into our offices with as well. So, and lastly, Airrosti, we are an in-network benefit for all of Austin ISD's Aetna Health Plan members on our in-clinic. Dr. Westbrook's office is right off of 32nd in Red River, but we have clinics all over Austin and all over Central Texas in general, making sure that we adhere to all the recommendations of the CDC to make sure that we provide a very clean and safe environment for not only our treatment teams, but also for all of our patients that come into there. So thank you all, lastly, for stopping in with us today.
I think we had like a couple more questions too, Chris.